interventional pain treatments without invasive surgeries.
Lutheran Home is now introducing its spine and joint clinic, offering tailored therapy plans, all in a comfortable, light-filled environment. Take a look.
Lutheran Home is a mission-based senior living community located in Arlington Heights, just outside of Chicago. We offer a range of services to meet an individual where they're at in their recovery journey. We offer skilled nursing services, inpatient rehab, outpatient rehabilitation, assisted living, memory support living, adult day club, and also child care, which offers intergenerational programming for the individuals who live in the community here. We're proud to be announced as Newsweek's Best Nursing Homes of 2025. Lutheran Home has been offering outstanding skilled nursing services in a beautiful setting for 130 years of not-for-profit service. Our mission is grace-filled living, and we live that every day. I come to work every day because of the people, my team members, the residents. They're the reason that I come to work every day. It's a family-like environment. I think that the residents do truly feel like we are their family. Not only us as team members offering them services, but their community within each of their neighborhoods. They really have a sense of community with their neighbors. Lutheran Home is excited to now offer, in partnership with the Metropolitan Institute of Pain, a spine and joint outpatient pain clinic.
Our goal is to treat spine issues as well as joint issues. As we all age, the natural process of the body, we develop wear and tear in our spine, in our joints, whether it's the cervical spine, the lumbar spine, big joints such as shoulders, hips, knees, to little joints such as thumbs, ankles. And most people who are senior citizens have issues at least in one of those areas, whether it's somewhere in their spine, in one of those joints. So our primary goal is when patients come in and they have pain that's affecting their quality of life, first of all, to really diagnose exactly where that pain is coming from, and then second, treating that pain directly. Our goal is not to try to mask symptoms. We want to identify where the pain is coming from and get to that pain generator and treat it as quickly, safely, and as efficiently as we possibly can.
This new clinic is a perfect addition to our campus, offering community members and residents an opportunity to see outstanding doctors and cutting-edge treatments.
This is incredibly unique. I think it's such a great, service that we can provide for patients. Being on site here, especially with some senior citizens, it's tough to get to a surgery center. It's tough to get to a hospital. There's a lot of transportation barriers. So us being on site here, we completely eliminate all of that. There's no waiting, there's no downtime. You come in, you get your procedure done, feel a lot better, you go home. You can just kind of walk back, to where you came from. And it's a pretty unique service that I think we have here. One of our main goals here was to help senior citizens, but pain starts for people of all ages. And so we treat really anybody who has pain. Our goal, people who are younger and senior citizens, is we want to try to avoid the need for surgery. So we use non-surgical interventional options to really get people feeling better, improve their quality of life, couple that with a customized physical therapy plan, and that applies to really anybody of any age. One of the benefits with our non-surgical interventional approach is that we really target the pain generator. And what that allows us to do is to avoid medications that could have potentially harmful side effects. So the C-arm machine, the reason it's called that is because it's an extra machine, but it looks like a giant C, so we call it a C-arm. And that's really what we use for our fluoroscopically guided interventional procedures. The reason the C-arm is so important is for two reasons. One, once we've identified where the pain generator is coming from, we take pictures in real time as we're doing the procedure. So with the fluoroscopy machine, every single time I move a needle, I take a picture so I can see exactly where it is in relation to the spine, to the joint, to exactly what target I'm trying to aim for, and I can get the medication within millimeters of where we want to go. The next, and in my opinion, more important benefit is that it helps us stay away from structures that we want to avoid. So every time I take a picture, I make sure the needle is not going somewhere I don't want it to go. In addition to our C-arm or our fluoroscopy machine, we also have an ultrasound machine, which is just another tool that we can utilize for imaging-guided procedures that we perform. So one thing that's really unique about our location here is that in my opinion, when you get a procedure done to help with pain, to help with quality of life, the best way to really get the most out of it is to couple that with a customized physical therapy plan. And what's really unique about our clinic is just down the hall, we have My Rehab, where there's a nice, beautiful physical therapy gym. Another hallway over, there's another even bigger physical therapy gym. So you really have the opportunity to get your treatment done, and then for long-term sustainability, get a customized treatment plan to really get the maximum benefit out of it.
For more information, just scan the QR code on your screen or head to mipainchicago.com. And for Lutheran Homes My Rehab services, go to lutherancommunities.org/myrehab.